Good evening and welcome to this town hall on children and vaccines. No more timely event in our entire nation than the issues we're going to be talking about tonight. This pandemic has had a significantly negative impact on children and parents from both health and social well-being perspectives. And now with the decision made yesterday, after meticulous and thorough review, for the approval of the Pfizer vaccine for children 5 to 11, which adds to the previous approval of vaccines for older children and adolescents, there is now a tangible enthusiasm that families can finally begin to return to more normal family and community life. My name is Dr. Reed Tuckson, and I am a co-founder of the Black Coalition Against COVID, welcoming you to the show tonight. Parents have important choices to make with and for their children about vaccinating against COVID, about the use of masks, and their risk tolerance for participation in a large number of social interactions. It is normal and responsible to have questions. That's why we've assembled an A-list of experts to answer those questions throughout our show. If you have questions that we are not covering, feel free to include them in the chat. And if we haven't gotten to them during the formal part of the show, we will address them at the end. Be aware that young people are in the chat also. So let's be respectful of what we say and how we say it. Tonight, we will hear from experts and parents from across the racial and ethnic landscape. The Black Coalition Against COVID, for example, is comprised by the 4 historically Black medical schools, Howard, Meharry, Morehouse, and Charles Drew, by the National Medical Association, the National Black Nurses Association, the National Urban League, and blackdoctors.org. We also tonight celebrate our relationship with our medical colleagues from the Association of American Indian Physicians, the National Hispanic Medical Association, and the National Council of Asian and Pacific Islander Physicians. We also want to thank our community advocate colleagues who recruited our parent guests from the Sault Ste. Marie tribe of Chippewa Indians, the Asian and Pacific Islander American Health Forum, Jack and Jill of America, and Mixteco Indigena Community Organizing Project. This town hall will be rebroadcast tomorrow, November 5th at blackdoctor.org, and then later archived on YouTube. As our colleagues at the Department of Health and Human Services always remind us, we can do this. And now it is my pleasure to introduce Cornecia McGill Brown. Cornecia McGill Brown is the national president of Jack and Jill of America Incorporated, an organization that boasts 252 chapters and represents more than 40,000 family members making a difference in communities nationwide. Welcome, President McGill Brown.
Thank you, Dr. Tuckson. It is such a pleasure to join you tonight. And I can't thank you and the partners enough for just having this important discussion, as we are just extremely excited about the fact that the vaccine is now available for children ages 5 through 11. As you know, the mission of Jack and Jill of America is to nurture future African-American leaders by strengthening children through leadership development, volunteer service, philanthropic giving, and civic duty. And in order to do this, we need our children, and not just our children, Jack and Jill, but all children, to be safe. And so we want to ensure that the mothers in our organization, mothers in our communities, and mothers just across the country are informed about their choices so that they can make the right decisions concerning this vaccine. And that is what we are about, just ensuring that the information is given and that everyone has access to the information so that they can make the right decisions for their children. As you can imagine, this has been a very trying time, not just for our organization, but just for all children across the country, all mothers and parents across the country, as we try to do our very best to make sure that the children remain safe during this pandemic. And so this definitely is a well-needed discussion as we try to provide accurate information. In Jack and Jill, we have COVID guidelines that we have implemented, and we continue to update those guidelines. And so as we follow the CDC and everything that comes out on a regular basis, we continue to keep our members informed so that we can continue to keep our children safe. So it is a pleasure to join you continue as we bring in the experts and to continue to get the message out to everyone to do the right thing in making the best choices for our children. Thank you.
Well, thank you so much, Cornisha McGill Brown. We really appreciate your leadership and the involvement of Jack and Jill in this program. And now it is my pleasure to introduce Anna King. Anna King is the president of the National PTA, which is comprised by millions of families, students, teachers, administrators, and business and community leaders devoted to the education success of children and the promotion of family engagement in schools. Welcome, Anna King.
Good evening, everyone. Thank you for the kind introduction. We do serve a lot of families across the country. It's an honor to be here tonight. And with the new school year well underway, the health and safety for our children and families continue to be the utmost priority for the National Parent-Teacher Association, also known as the PTA. At PTA, we know our parents, families, and students have been doing all that they can to keep some type of normalcy. Unfortunately, the pandemic has further reminded us that our public schools are extremely under-resourced and that there's a great disparities in the quality of access and opportunities, especially for our Black and brown families. Our students and families nationwide are dealing with the impacts of interrupted learning, the loss of family members and friends due to COVID-19, and the increased need for mental health support and resources. And it's important to note that the events of the past 19 months have had an uneven effect on our communities, depending on our ethnicities, socioeconomic status, gender, and other identities. We know for a fact that COVID-19 is affecting our Black, Indigenous, Latino, and other people of color the most. Personally, as an association that serves over 13 million students, 57% of which are children of color, the fact weighs heavily on our minds. We know that PTAs are the strongest when they represent the communities that they serve. And that means respecting differences, acknowledging shared commonalities, addressing inequality, and then developing meaningful priorities based upon their knowledge. That's how we make sure that every child's potential becomes a reality. At National PTA, our goal is to be the guiding, thoughtful resource for every child and family as we navigate this new normal. PTAs nationwide have been advocating at the federal, state, and local levels for resources to improve the health, safety, infrastructure, mental, social, and emotional needs of students, educators, and school staff. In addition to their advocacy efforts, during the darkest days of the pandemic, PTAs across the country rose to the occasion and solved real problems for their students and families. Much of this work was made possible by the generosity of our corporate sponsors and partners, who enabled National PTA to distribute over $1.3 million in grant funding to support communities in dire need. Our PTAs nationwide address food insecurity, provided technology and internet access to bridge the digital divide, and delivered resources to support the mental, social, and emotional health of the school communities. We know that mental health is the most pressing issue facing children and their families right now, particularly given the outsized impact the pandemic has had on our communities of color. That's why we launched our newest program called Healthy Minds. It aims to reduce the stigma around talking about mental health, and we believe that all children and parents should have the access to support the need to cope with the stresses of life. You can get these resources at pta.org/healthyminds. Finally, we have also done some wonderful work this year with the CDC Foundation to conduct listening sessions and a national survey of parents from across the country to better understand what's going on in their minds. You can find detailed results of that poll, once again, at pta.org/backtoschool. But finding the undersource, the fact that the strong partnerships between families, teachers, and administrators are more important now than ever as we address the impacts of the pandemic. The FDA's recent unanimous decision to endorse Pfizer COVID vaccine for for 5 to 11-year-olds represents a new opportunity to ensure that the parent voice is heard and valued. That's why events like tonight, Town Hall, are so important. Understandably, it can be difficult for parents to navigate through the wide range of opinions and overwhelming amount of information about immunizations. And I hope that by the end of this event, parents feel empowered to make the most informed decisions possible for their children. I want to thank you, Dr. Texan, for giving National PTA the opportunity to welcome you all here for such an important conversation. It is my hope that everyone watching, that you will leave this town hall with the information and tools that you need to make the best decisions for your family. I'm looking forward to following the rest of the conversation. National PTA will be taking notes on everything that we learned this evening. Thank you.
And now it is my very great pleasure to introduce Dr. Lee Savio Beers. Dr. Beers is the president of the American Academy of Pediatrics. She is a professor of pediatrics and the medical director for community health and advocacy at the Children's National Hospital. The American Academy of Pediatrics represents 67,000 pediatricians who are committed to the optimal physical, mental, and social health and well-being for all infants, children, adolescents, and young adults. Welcome, Dr. Beers.
Oh, well, thank you so much, and good evening. I'm so happy to be with you and with all of you in this hopeful moment and really important turning point in our struggle to end this pandemic that's weighed so heavily on children and families and upended so many lives. You know, since the pandemic's onset, close to 6.4 million children have been diagnosed with COVID-19. And while we know infection is generally not as severe as it is in adults, many children have become very sick from the virus. Pediatricians who I represent have seen its impact firsthand in our clinics and ICUs across the country. Some recent CDC data shows COVID-19 associated hospitalization rates are up to 3 times higher than hospitalizations from the flu. And more than 5,200 children in the US have gotten a severe multi-system inflammatory condition known as MIS-C following a COVID-19 diagnosis, which can really have debilitating physical effects. And tragically, more than 600 children have died of COVID, and a disproportionate number of those children have been Black and Latino children. No child should have to suffer or die from a vaccine preventable illness, especially now that we have a vaccine that's safe and highly effective. As we come off a record surge in child COVID cases and head into the colder months with conditions that facilitate the spread of the virus, we still have a high level of transmission in new cases in children. But the really good news is we now, to a large extent, have control over what the holiday season and the rest of the school year will look like. You know, as a pediatrician, vaccines have been a part of my professional career for decades. Nothing has proven more successful in preventing disease and infection. And I know the benefits of this vaccine and the long-standing, rigorous, transparent process it went through before it was authorized by the US Food and Drug Administration and the Centers for Disease Control and Prevention. So I'm a mother too. I'm a mother of 2 teenagers, and my children received the COVID-19 vaccine for ages 12 to 18 as soon as it became available. And for me, vaccinating my children was an easy choice. And I've been counseling parents and other pediatricians I work with have been counseling parents to get their children the COVID-19 vaccine as soon as they're eligible. The COVID-19 vaccine is safe, it works, and it's free of charge to all people living in the US, regardless of their immigration or health insurance status. The American Academy of Pediatrics has been working with pediatricians across the country to prepare them to receive and administer the COVID-19 vaccine. We're eager and we're ready to offer all children ages 5 and up this protection. And understandably, parents will have questions. And so we want to make sure that every family has the information about the vaccine and the science behind it. And that's why I'm just so glad to see these conversations taking place tonight between medical experts and parents. Pediatricians are also eager to help. So please call your pediatrician to find out more about the vaccine and make an informed decision about protecting your child, your loved ones, and your community from COVID-19. Thank you again, and we look forward to hearing from you.
Well, thank you so much, Dr. Beers. We really appreciate that. And now it is my pleasure to turn to a conversation between 2 of the nation's leading experts in COVID, in this disease, who also are parents of young children and who are representing in this conversation that we are having with them now, what the challenges and the decision process is for how to make informed choices about whether to participate in getting your children vaccinated. First, we have with us the Surgeon General of the United States, the Surgeon General Vivek Murthy, the 21st Surgeon General of the United States, the nation's doctor. His mission is to restore the trust of American people by relying on the best scientific information available, providing clear and consistent guidance and resources to the public, and ensuring that this information reaches our most vulnerable communities. I'm also pleased to invite my friend, Dr. Lena Wynn, former health commissioner for the city of Baltimore, currently serves as a research professor of health policy and management at the GW University. She is also a contributing columnist for the Washington Post and a very frequent guest on CNN, the author of a new memoir, Lifelines, A Doctor's Journey in the Fight for Public Health. And I thank both of you for joining us. And let me begin with you, Surgeon General Murthy. Can you set the context for us of where we are now in this pandemic and what it means for the nation's children?
Well, thank you so much, Reed. It's really great to be with you today. And it is always such a joy for me to have the chance to share the stage with Dr. Wen, who's a good friend and who's just been such an invaluable voice during this pandemic, helping educate the public. So here's where we are during this pandemic. We've been at this for about 20 months now, going on 21 months. It's been a long stretch for most people here in the United States. But there are signs of progress that we have been making, despite the millions of cases we had, despite the fact that we have now lost 750,000 people to this virus, which is a truly tragic milestone. But here's where we've made progress. Number one, we've got 3 vaccines now available, which are remarkably effective at helping to reduce the worst outcomes of COVID, hospitalization and death. And we didn't have that last year. Number two, we've got 190 million people in our country who are now fully vaccinated, which is great news. There's still millions more who are not, 60 million plus. And so we've got more work to do. But the other big news that's really positive is that we now have the opportunity to boost people, to offer them a 3rd shot of Moderna or Pfizer or 2nd shot of Johnson & Johnson, which will extend the protection that many people have received from the vaccine. But perhaps the last 2 things I'll mention are that we are also coming down from a very high peak of cases, daily cases that we were seeing with the Delta variant. We were significantly higher. We've been reducing over the last 3 weeks. We've got a long way to come down, though, because we're still at around 70,000 plus cases a day, but progress certainly from the peak. But finally, and this is the part that to me is most exciting, given that I have kids, is we now finally have an option for vaccinating our kids 5 through 11 after a recent decision by the FDA and CDC to authorize and recommend vaccines for that age group. So that means 28 million more people in our country who can be protected against COVID-19.
It really is encouraging and extraordinary news. Doctor, when you, as I mentioned earlier, are the parent of young children, and also you are, in addition, of course, a noted national expert. How are you going through the process in your own home of weighing the risk and benefit of vaccinating children? And how can you help the parents that are listening to us tonight to make those calculations for themselves?
Yeah, I appreciate the question, Dr. Tuxen, but also great to join my friend and colleague, Dr. Murthy, here today. Thank you so much for your service and leadership during this time. And thank you to all those watching for everything you have done to help to overcome vaccine hesitancy and to get us through this phase of the pandemic. Now, my children are actually too little to get the vaccine at this time, unfortunately. So I have a 1.5-year-old and a 4-year-old. And so for the time being, my husband and I are watching with a lot of envy at our friends whose children are now getting vaccinated. You asked a really good question about how to weigh the risks and benefits. And I think this is something that all of us as parents, pediatricians, physicians, et cetera, that's all we think about, as in we want what's best for our children. And so it's very natural, very understandable that parents have a lot of questions and are thinking about this. So this is the way that I would consider this important question. One is to consider the extremely thoughtful, thorough, careful regulatory process that the vaccines have been through. As Dr. Murthy mentioned, there was this process going through the FDA, process going through the CDC that was transparent and that really took into every consideration in making sure that the vaccines are safe and effective in this age group of 5 to 11. The other very important part is for us to be very clear that even though children tend to not get as ill as adults, they can, and unfortunately, many have become very ill due to COVID-19. There is this false and pervasive narrative that we have to counter that somehow children are not susceptible to COVID, which is just not true. In this age group of 5 to 11, according to the CDC, there have been more than 1.9 million children who have gotten COVID-19. There have been more than 8,300 children who are hospitalized. About a third of them have ended up requiring intensive care. We also know that tragically, about 100 children or so have died in this age group, and that COVID in this group of 5 to 11-year-olds is now one of the top 10 leading causes of death. And here's the thing, children are not supposed to get ill. They're not supposed to die from COVID. And I know that all of us as parents, we want to protect our children. And so if there's something we can do to protect them, and also very importantly, to give them their lives back so that they can have sleepovers and birthday parties and to reclaim the sense of normalcy that they have lost, I hope that that is what parents will consider in this important decision ahead.
And for you, Dr. Murthy, how do you make that same calculation in your house, and how do you advise others at home to make the calculation for themselves?
Well, it's a really good, important question, because I think about this not, as Surgeon General or as a doctor, but first and foremost as a parent. And when I think about it in that regard, I think first of all about the cost of COVID for our kids and for my kids. I have a 5-year-old son and I have a 3.5-year-old daughter. So my son is now eligible to get vaccinated. And when I look at the toll on our kids of having to go through this pandemic over the last almost 2 years, it's really substantial. They're missed opportunities they've had to be with family and friends. School has been interrupted. Youth sports have been difficult. And of course, there's a health impact too. And what Dr. Wen mentioned was so important. The numbers helping people understand just how consequential COVID has been for our children. There is a myth out there, Reed, that COVID doesn't really bother kids. It's not a problem in kids. What is true is that COVID is, our kids do much better with COVID-19 than older adults. And thank goodness they do much better. But it's a far cry from saying that COVID is harmless in children, because it's not. And if you talk to any of the parents of the thousands of children who have been hospitalized, they would certainly reaffirm that and tell you that's the case. So look, as a parent, first and foremost, I want to make sure that my child, that all children have protection against the vaccine, against COVID-19. What I want to make sure, though, is that the vaccine is both effective at preventing COVID and that it's safe also for my child. And I think most parents want to know that. And that's why I've been really encouraged by what the FDA and the CDC found in their review, which is that the vaccine in kids 5 through 11 was more than 90% effective at preventing symptomatic coronavirus infections. That's great news. But what they also found, which is equally as important, was that the vaccine had a strong safety profile. The side effects they did see in children were mild side effects that included things like soreness and pain at the injection site, a headache, fatigue, in a small number of cases, a fever. But here's the important thing. These symptoms lasted for a day or two, and then they went away, leaving children with protection against COVID-19. And they did not see serious adverse events occur with children during these clinical trials. That was really, really good news. So all of that data together is what made me and my wife, Alice, feel good about getting our 5-year-old vaccinated. And so we plan to do that as soon as possible.
You've emphasized something that Dr. Wen did as well, and that is the rigor of the review process and what it showed. You gave us the data. I just want to make sure that we are listening carefully to you, Dr. Murthy, about how comfortable you are with the rigor of the entire review process. Are you comfortable?
So yes, I am comfortable with it. And I've actually been in close touch with colleagues at the FDA, at the CDC, throughout the administration over these last many months. And a couple of things I can tell you. One is that making sure that we approach this decision about vaccines in a way that upheld the highest standards of safety and review that the FDA has had for years and that the CDC has had. This was a top priority. And people wanted to get this right and do right by our children. And they wanted to make sure that no corners were cut. And so the same high standards that the FDA holds any vaccine to that our children receive, they applied those same standards to this vaccine as well. And I want parents to know that, because it's why I, as a parent, actually feel comfortable about the review process that was done and about the recommendation that was rendered.
Great. And Dr. Nguyen, one of the things that you have done as such a service to the nation has been your very practical guidance about what people can do or should do at each stage of the pandemic. And so when you start to consider now that children 5 to 11 and those older now will be able to be vaccinated, what does it mean for our holiday season, and what kind of advice and guidance are you giving yourself and others in your community about how to enjoy the holidays this season if you are vaccinated?
Well, I really appreciate the question, because I think it's important to talk about all the things that we can do and to point out the benefit also of vaccination. This is a very different holiday that we have coming up than this last year. And actually, we just had Halloween, and even Halloween for so many families was night and day different. And Thanksgiving, Christmas, etc., coming up will also be very different because people are vaccinated. And also we know even more about how we can protect ourselves and manage risk. I do think it's important to level set and say that at this point in the pandemic, we are coming to terms with the fact that we have to live with COVID. And so that means reducing risk. It means that virtually every activity that we do has some level of risk, but you can reduce that risk substantially because of the protective effect of the vaccine. And so if everyone is fully vaccinated and generally healthy, it would, I think it is a reasonable decision for families to make, to say that we're all going to gather once again indoors, no masking, no distancing. We're going to enjoy the times as we did in the past. By the way, because kids 5 to 11 are now able to be vaccinated, if they get vaccinated now, the first shot now, and then the second dose 3 weeks later, they'll be fully vaccinated in time for Christmas and New Year's, which is really exciting. And I know many families have been looking forward to that. I also think that there's some families that for any number of reasons might want to take additional precautions. Maybe their family coming in from different parts of the country. Maybe there are some older family members or individuals with immunocompromise. Perhaps there might be young children who are too young to be vaccinated yet. If that's the case, there are other ways to increase your protection as well. One, of course, is that you can see one another outdoors, which is extremely protective because of the increased circulation of air. If you want to be indoors, another method to use is for everyone to essentially quarantine, meaning to reduce their own risk. No going to bars and restaurants indoors, no seeing other people in that period of time, but to quarantine essentially for 3 to 5 days prior to seeing one another, and then add on top of that a rapid test right before getting together. That would reduce the risk of transmission even further. But all this is to say that there are so many ways for us to now get together in a way that wasn't possible last year. And we have in large part to thank the protective effect of the COVID vaccines.
And the last question for you, Surgeon General, and again, for your family, you've got one child that's eligible for vaccination and one that isn't. What does that mean in terms of having grandma over to the house for the holiday?
Well, it's a really good question, Rita, and we are very excited for our son to get vaccinated, but we can't wait for the day where our daughter will also have a vaccine and where Dr. Nguyen's 2 children will also have a vaccine. And that may probably, hopefully will come in early 2022, in the early part of the year, which we're all certainly looking forward to. But as far as, what we do, given that we have and will have an unvaccinated child at home for at least a few more months, that means to us that it's important for us to continue taking precautions with her. So we still make sure that she's masked when she's out in indoor public spaces, and the rest of us do too. We also try to make sure whenever possible that the people she's getting together with are fully vaccinated themselves. When we've had family who's wanted to come over and visit, we've actually utilized rapid testing on top of making sure they're vaccinated, just as another layer of precaution to make sure that the risk is lower to our unvaccinated child. And finally, we think about the activities that our daughter participates in as well. We tend not to let her go and, let's say, do play dates with other kids indoors who are unvaccinated and poorly ventilated spaces. Instead, we try to find outdoor spaces for her to play with other kids in, where the ventilation is better and the risk is lower. So the bottom line is, as Dr. Wen said eloquently, there are ways for us to live our lives despite COVID. And we thankfully have many pathways to get back to the activities we love, because we've learned a lot from COVID over the last 20 months. We have vaccines. We have rapid tests in greater and greater availability, which is helping us. And we know how to use masks and better ventilation to reduce our risk even further. So this gives me hope that as the holidays approach, that we can look forward to many of the activities that we really enjoyed and loved before. We just have to be thoughtful and smart in how we go about them. And again, vaccination remains at the heart of our strategy, because it's really one of the most effective ways to reduce your risk.
Well, thank you both for helping us to be thoughtful and smart. And also thank you both for the service you're giving to our nation and for enhancing the health of all the people in this country. Thank you both for joining us today.
Thanks so much.
Thank you.
And now it is my pleasure to introduce Dr. Rhea Boyd. Dr. Boyd is a pediatrician, a public health advocate, a scholar who writes and teaches on the relationship between structural racism and equity in health. And she's a partner with the Kaiser Family Foundation. She has developed with them something called The Conversation Between Us, About Us, a national campaign to bring credible information about the COVID vaccines directly to Black and Latinx and Spanish-speaking communities. Welcome, Dr. Boyd, and please help us to understand from your polling data, what are we hearing about how parents are thinking about vaccinating their children and where they are in terms of making a positive or a negative decision at this point early in the decision-making stage?
Thank you so much for having me, Dr. Tuckson. So this is an important question. We at the Kaiser Family Foundation have been working to poll parents across the pandemic to think about how they're going to approach vaccination decisions. And what we're seeing is that right now, for the about 30 million kids that exist in this country under age 12, or those who are 5 to 11, a third of that group, about 10 million families, have said that they plan to vaccinate their children as soon as they can. Which means because the vaccines were authorized by the CDC and FDA, for many families, that means today you could go to a site where you regularly receive your child's vaccines to get a COVID vaccine. But there's still about a third of families who say that they want to wait and see how kids 5 to 11 respond to the vaccines before making that critical choice. And then there's a third of families, which is about 10 million kids age 5 to 11, who say they definitely will not vaccinate their kids. And so the folks that we are working for to help better understand how we can give them the information they need to make this critical choice is that 10 million folks in that wait and see group. When we think about who exists in that group, we know that for kids who are under age 12 in this country, more than half are kids of color. And so our campaign at The Conversation, which is partnered with Black Coalition Against COVID and Unidos US and with the American Academy of Pediatrics, we are doing outreach among communities of color, particularly Black and Latinx communities, to make sure our communities have the information they need and the credible science that it will take to make this decision in the right interest of their kids.
Wow, that is really, really helpful, Dr. Boyd. And one last comment, if I could, for as you are talking to parents about how to make this decision, those that are in the wait and see or the no category, what's the simple message that you are giving to your patients as you are interacting with children in your work?
So the thing that we've really focused on is family vaccination, which means the more people in your household that are vaccinated, including the kids in your household, the less likely your household is to contract a case of COVID. There was just a recent study that told us, after looking at 800,000 families, that each additional person who gets vaccinated decreases the risk of COVID as much as 97% in your household. So having your kids vaccinated is a huge part of the effort. And the second thing I'll say is one of the number one concerns we hear from families is they're worried about long-term side effects and potentially about their child's fertility, especially for their younger kids. And so we always try to help people understand that all of the vaccines that have been authorized to date by the FDA have not seen long-term side effects after the first couple of months. And so we are reassured that we did not see serious side effects during the clinical trials for ages 5 to 11, and that we don't expect there to be long-term side effects that are unknown at this point, because that simply hasn't happened in the history of the development of vaccines. And we also know that the COVID vaccines don't affect children's fertility or reproduction. So families can feel confident when they make the choice to vaccinate that it's a safe choice for their kids.
Thank you so much for that. And Dr. Boyd, that was a perfect segue to our next and very, very, very special guest. I'm very happy that Dr. Peter Marks is once again joining us on one of our town halls. Dr. Peter Marks is a physician scientist trained as a cell and molecular biologist, hematologist, and oncologist. He has practiced medicine, worked for industry, and served as the chief clinical officer of a cancer center prior to assuming his current position as the director of the Center for Biologics Evaluation and Research at the FDA. Simply put, Dr. Marks is an expert in this field, one of the nation's experts, but he is also the person who is accountable for leading the process and making the decision ultimately for the FDA on whether or not a vaccine is approved for human use in the United States. And clearly he is at the center of the decisions about childhood vaccinations. Dr. Marks, welcome, and please, let's start our conversation off with the basics, just to make sure that everyone listening is on the same page. Talk to us about what a vaccine is and what it is, what it does, and what it is intended to do as we put it into the biology and the bodies of our children.
Yeah, thanks so much. Thanks so much for having me and for doing this, Reed. So the vaccines are doing something in the body that we do every day in our lives. And your child, when your child goes out to the playground, they actually encounter things that they have not seen before. Possibly it might be some dirt that they even eat. And it might have something in it that like a bacteria or a mold. And their body sees that as something foreign, and it makes an immune response so that they don't get sick from it. Vaccines are just doing that same thing, except we're coaxing the body to do that in advance of seeing, in this case, the COVID-19 virus, the virus that causes COVID-19, SARS coronavirus 2. So what's happening here is we are using a bit of a trick by giving, in the case of the mRNA vaccines, giving a little piece of the code that makes the protein for a piece of the COVID-19 virus, the virus that causes COVID-19. And that code ends up making the protein on the surface of some cells in the body. And the body's immune system sees that as foreign and generates an immune response, much the same way as it would a natural immune response. And that's what gives one protection then against this virus. So what's going on here is not anything magic. It's what we do every day when we encounter foreign things. It's just we're helping the body to do that in advance of seeing the virus instead of having to get the virus in order to get immunity to it. And ultimately, the good thing about this particular vaccine, the one that was just authorized, is that these mRNA vaccines, the mRNA is broken down by the body relatively quickly within days, and the rest of the parts of the vaccine are eliminated. The vaccines don't contain mercury like older vaccines did. They don't contain things that people generally get upset about, such as aluminum sometimes. So these are very, they're a very good way of helping to protect us against the virus when we encounter it in the future.
Great. And Dr. Boyd mentioned something, the word clinical trials, which of course is the way that scientists such as you get the information that we need on real life use of the vaccine in the human body. Many people have asked us already in the chat and in other places, how were they developed so fast? Can you talk about whether or not they in fact were developed, quote, fast?
Yeah. So the way these vaccines were developed, end quote, fast, close quote, is that what normally happens in vaccine development is we start and stop development multiple times as we go from one phase of clinical trials to another. In other words, we do small trials, then we do larger trials, then we do really big trials. And it can take years to get through that. In this case, they were all collapsed into one sequential trial where it started out small and then grew into a really big trial. How big? For the adults, it grew into a trials that had, 40,000 people enrolled. And for the kids, into trials that had several thousand children enrolled. And so this way of doing things allowed one to get the same kinds of answers that we get when we take a few years sometimes, but to do it in a much shorter time. The nice thing about this is no steps were skipped. The one piece, let's be honest and have full disclosure, normally we like to have 6 to 12 months of follow-up on for safety after the last doses of the vaccines. Here, instead, we have a few months of follow-up, but we're using our sophisticated safety surveillance systems to watch the children and adults who have gotten this vaccine to make sure that nothing is coming up. And the good news also is that most adverse events with vaccines, they occur within the first 6 weeks of getting the vaccine anyway. So I think we're in pretty good shape here for knowing that these vaccines are safe to give to our children.
Can I also just have you confirm that I know one of the issues that also many people are concerned about, or they question, that that there were hundreds of scientists from around the world that have been involved in the clinical trials, and hundreds of physicians and specialists in this country who were evaluating the data, who are not part of the government. These are private experts in the field, and many of whom are also physicians and scientists of color. Can you confirm that to be true?
No, that is absolutely the case, and you can go back and you can look at the video of our advisory committee meeting, and you'll see some very prominent figures in the Black medical community who are on that advisory committee looking at the data. Among them, the president of Meharry Medical College. There are, and I don't mean to, I'm leaving out others who I'm sure are going to be mad at me for leaving out their names, because there are quite a few others. We are we're very happy that we've had a very diverse group internally within our FDA family, but externally as well, looking at these, because that's really important to us. The goal here at the end of the day is to make sure that this has gotten a thorough look, because at the end of the day, making sure that these vaccines are safe and that they do what they're supposed to be doing is what our job is. But it's also our moral responsibility to people, so that we got to do it right.
That's exactly it. And one other, you're going to be with us throughout the show, but let me just ask you one more quick question right now, because I know this is one of the issues that our surveys of parents has clearly indicated, and that is, can these vaccines change my child's DNA?
Yeah, so this is one. There are some questions I always answer with a little bit of concern. This one I'm actually going to answer just full out. The answer is no, and the answer is because there's just no possible way. The mRNA, which is a type of genetic material, it's a messenger. It's usually used to shuttle information from DNA to make protein. The problem is that it's located, when in these vaccines, it's located in a place in the cell where it can't get access to your child's heritable genetic material or to your heritable genetic material. So it can't get there. Plus, our bodies do not have the enzyme necessary. That turns out to get that into your DNA, you actually need a special enzyme, and we don't have it. Really, the important piece here is to understand that this is not something that we have to worry about. It's not going to change your child's DNA. It's also not going to change your child's or your fertility. It is something that is one of those things that's kind of got urban lore, and it's scaring people off the vaccine, and that's a sad thing because that shouldn't. There are true side effects that can happen with these vaccines that are, but in general, they're very mild, and they go away after a day or two.
Well, we will come back to this issue in just a moment, but I wanted to be very clear that was a very good and comprehensive and long answer to a simple statement, which is no. And I think we need to be very clear about that. Well, I mentioned that the Black Coalition Against COVID has many partners. What we also are is a group of community-based leaders across Washington, D.C. And our experience in Washington, D.C. at the community level is to always be involved with listening to parents and having conversations with the community itself very intimately. And we're going to do that now. And so it's my pleasure to introduce two pediatricians to join us, Dr. Patricia Whitley Williams, who is the Division Chief of Allergy, Immunology, and Infectious Disease, Professor of Pediatrics at the Rutgers Robert Wood Johnson Medical School, and a representative from the National Medical Association for the Advisory Committee on Immunization Practices at the Centers for Disease Control. That is the other federal body that makes the decision after the FDA does on whether vaccines are approved and who they should be approved for. That committee just made its decision yesterday, so we couldn't be more timely in having Dr. Williams. We also have Dr. Shakita Bell, who represents the Association of American Indian Physicians. She is the interim senior medical director for the Odessa Brown Children's Clinic in Seattle, and she also serves as the clinical professor of pediatrics at the University of Washington School of Medicine. I'm so glad that they are joining us, as are Michelle Davis, a parent who is coming to us from Jack and Jill, and Laura Downwind, who is with us, who's called me by phone. Unfortunately, her internet isn't working today, but she is a Native American parent. And so I will start with the question to our two physicians. Let me begin with you, Dr. Williams. What is the simple message that you are sending to your patients as you are talking to them about childhood vaccines?
Well, absolutely. Thank you very much, Dr. Tuckson, for having me, and good evening, everyone. I think the main message is that the COVID-19 vaccines are safe. They are here and ready to be given to children ages 5 to 11. We know that parents really care about their children. They don't want to do any harm. So the message is protect your children. The vaccines are safe. If you're listening before, the side effects are very mild. And we know that you want to protect your children. We want to get back to the way we were before and go to school, etc. So the main message is please get your children between 5 and 11 years vaccinated.
And Dr. Bell, your opening comment as well.
Yeah, thank you. I agree with Dr. Whitley Williams. I would add that we know many children are under-vaccinated right now. Many of us kept our kids at home during the COVID pandemic and didn't seek care unless there was something wrong. So many of our children are not vaccinated with other childhood vaccines. I think the opportunity of getting COVID vaccine is another great time to catch up on your childhood immunizations. This is an opportunity to get your flu shot done, to get your tetanus booster in, to get your hepatitis booster in, all of those things. So in addition to being clear that it's safe and effective, I think it's also important that we can do as many vaccines as possible while you're in our offices.
I think this is such an important point, and let's really underscore this. Not only is it important to get your child vaccinated against COVID, but all of the other preventable illnesses. We've made such progress in this country and around the world in stamping out childhood preventable diseases. And I just sincerely hope and pray that some of the misinformation about COVID vaccines don't cause a rebound effect to diminish the chance for our children to be protected from other diseases. While I have you there, Dr. Bell, Laura Downwind, as I said, called in to me just a few minutes ago. And one of the things she wanted to explore and see what your thoughts were is that we've known that distrust is a big issue for communities of color, and particularly for the Native American community as well. She's sort of hoping that since we've had the experience with other vaccines now being available, that some of that distrust is eroding and starting to go away. What are you seeing in your community and in your practice?
Yeah, I would totally agree with that observation. I think one of the things that I want to validate is that medicine has been harmful. Historically, there's been exploitation and experimentation and outright genocide of our people. And so I never want to invalidate that feeling. It is wise to be cautious. The reminder is that this is a global pandemic. This is so much bigger than the US and the history we have here. It is really impacting communities all over the globe. And these vaccines are similar all over the globe. It's not like we're giving special vaccines. They all have different brand names, but they got the same ingredients. So it's really important to make sure people understand that concept, that this is not about America, this is about the world. And then I would say, as we are able to get out in the community more, the other thing we know is, especially for Black and Indigenous communities, what is good for our community is good for us. So putting this messaging around, I am doing this so I can help myself, but I'm also helping my elders. I'm also helping my babies. I'm also helping folks who can't get vaccinated because of their medical conditions. That is a really important message as well. And because of that, I think we have seen phenomenal vaccine rates in Indian country. We've seen tribes who are nearly 100% vaccinated and who have taken their supply and started vaccinating, offering vaccines for other communities, which is such a beautiful story. I think the key there is remembering that it is us, we're all in it together, and everything that we do as an individual helps everyone else as well.
I think that's so key. And put it in context again, 6 billion doses of vaccine around the world. For those who are sort of saying, I'm waiting for what? 6 billion doses around the world. Michelle Davis, what is your question or observation to share with the panel?
Good evening. Thank you, Dr. Tuckson. So I'm coming from the Washington, D.C. chapter of Jack and Jill, and our mothers have concerns around whether or not the vaccine dosage is going to be different for the children than for the adults. In addition to, are they going to, after the 2 doses, be expected to have a booster after 6 months, as we've seen with the adults, in order to boost the immunity to the COVID virus?
Well, Dr. Patricia Whitley Williams, as I said, you're fresh from not even 24 hours, probably from the end of the meeting that made the decision on this very point. What's your answer?
Certainly. So yes, the dose is smaller than the adult dose. It's about 1/3 the dose, but guess what? It produces the same amount of immunity. And in fact, it's more than 90% protective against the children getting infected, getting sick, getting hospitalized with COVID. So it's a terrific vaccine, and it's just as potent, even though it's at 1/3 the dose. The second thing I would like to say is, yes, if right now, as you know, only Pfizer has the emergency authorization, so that they would get the first dose, and then 4 weeks later, they get the second dose. And then the booster, the good question about the booster dose, I think that is still to be seen. But yes, they may need a booster dose, but I think we're going to have to see where we are with the pandemic at this point. But getting the Pfizer vaccine, they will get 2 doses 4 weeks apart.
And I would imagine, Dr. Whitley Williams, that one of the things we really want to be attentive to first is getting our parents to feel comfortable about getting that first dose, but then we got to get the second dose. Why is the second dose so important?
Because it really confers that it allows that child then to be protected, greater than 90% protection. So without that second dose, the child may not get that full protection. And we want every child to be protected. So it's so important to get that second dose. It also has to do with how long that child will keep that protection. So it is so important. We know that from the clinical trials, and we don't want any child not to have the full protection, especially if they've gotten the first dose. So by all means, 2 doses, 4 weeks apart.
And Dr. Bell, one of the questions that our colleague Downwind raises is, as Laura wants to understand, is that what they want to get is since there are some parents who have children that are younger than 5, what do we do inside of our homes once we can get our 5 and up vaccinated? How do we handle those that are too young yet to be able to receive the vaccine? What are the steps we need to take?
Well, I would say, first of all, pretty much what we're doing right now, right? Continuing good hand hygiene, continuing masking, continuing social distancing, things like that. I think one of the most amazing pieces of this pandemic is we have learned that breastfeeding is enormously protective for babies. So if you are a breastfeeding mom or parent, that's great news. And I've had several parents in my practice continue to breastfeed because we know that it is passing immunity on to their babies. There are several vaccine trials going on right now for babies or for kids who are under, I guess my 4-year-old nephew would not like to be called a baby. For some kids under 5, that is going on right now. And we do hope to have more information about vaccinating that age range later next, probably spring, late winter, early spring. We'll have more information on that timeline. But in the meantime, it's really similar to what you do right now for your 5 to 11-year-olds. It's making sure they stay safe. It's not gathering in large groups. It's keeping those masks on. And if they're 2 and over, and washing hands frequently.
Terrific. Michelle Davis, do you have another question to pose?
I do. Thank you very much. So I had one question from a parent who is very concerned with, is there any circumstance under which you would not recommend a child be vaccinated or receive this particular vaccine? And if so, under what circumstance would that be?
Good. Dr. Whitley Williams.
Yeah, so that's a great question. There are some medical conditions in which you may not want to vaccinate a child, but actually for those who are most vulnerable, including, let's say, patients who may be immunocompromised, may have HIV, any of the other chronic illnesses, morbid obesity, there are many conditions where we do vaccinate. So there really are not that many exclusions. It may be children who might be on active chemotherapy, being actively treated for cancer, undergoing transplant, on immunosuppressive medications to prevent them from rejecting those transplants. So there are those conditions.
Great. And Dr. Marks, are you still in the green room there? Do we still have Dr. Marks? All right, we'll come back to him. Oh, there he is. Yeah, Dr. Marks. One of the questions that we are seeing in one of our chats is the issue of children with allergies. Can you comment a bit on whether or not kids with allergies are contraindicated or not recommended to get the vaccine?
No, actually, probably quite to the contrary, because many children with allergies also have asthma that goes along with that. And it's probably a very good idea in general for children to get vaccinated. Now, if a child has ever had an allergic reaction to a medicine, and particularly an injected medicine, the parent's going to want to tell the doctor or the healthcare provider that that's happened, because it doesn't mean that they won't be able to get the vaccine, but it may mean that they're going to watch the child a little more closely for a little longer after the vaccine is given. But there's no reason in general, if it's just the kind of allergies like to household dust and pollen, those things, or asthma associated with it, probably all the more reason to get vaccinated, because those kids don't need to get COVID on top of that.
Thank you. And Dr. Bell, some of the people in our community with sickle cell disease and other immunocompromising diseases may have anxieties and concern. What do you say to those parents?
Yeah, thanks for the question. I think one of the things we're prioritizing in our clinic right now is reaching out to our patients and families with sickle cell. We know that the condition of sickle cell raises the risk for mortality and morbidity with COVID infection. So it is very important for folks who have sickle cell and other immune compromising diseases to talk to their doctors about whether they're eligible for the vaccine and how soon they can get it. We're actually setting aside several appointments just for that purpose so that we can make sure our children and families with sickle cell have access to this vaccine as soon as possible.
We're going to move this conversation forward in some other directions, and I would ask you, Dr. Whitley Williams and Dr. Bell, if you will just stay around and along with Dr. Marks, as I bring in now, though, Dr. Roberto Johansson. We call him Bert Johansson. He is the executive board member of the National Hispanic Medical Association, a pediatrician in El Paso, Texas. He's been in practice 28 years and specializes in pediatric critical care medicine. We're also being joined by Dr. Susan Wu, a member of the National Council of Asian and Pacific Islander Physicians Board of Directors and the Chief Medical Director for Quality and Clinical Effectiveness at the LA Children's Hospital, where she's also an associate professor of clinical pediatrics at the Keck School of Medicine. Our parents who are joining us are Griselda Reyes from our Hispanic community, and we're happy that Marla Arciniga is going to help translate her, and we were fortunate to get Marla from our colleagues at Mexico Indigena Community Organizing Project. And we're also joined by Ian John from our Asian and Pacific Islander community. Let me start with you, Bert Johansson, and sort of get your reaction to what's been said and the points that you would like to emphasize the most as we go forward. And it looks like maybe Bert has not joined quite yet, so we will be very happy to move to Dr. Susan Wu. And Susan, you've been on our show multiple times. Thank you once again. And what are the messages that you either want to underscore or that have not been raised that you think are important?
Yeah, I think most of the most important messages have been said before, but I'll repeat it. The vaccines are safe and they work. And if we all know that everyone in our community, we want to take care of our children. They're our most precious resource. We want to take care of our families and our communities. And the way to do that is for us to all get vaccinated. That's the only way we're going to get out of this pandemic, is to stop this pandemic, is if we all do this together. And, you know, we're so excited to be able to now vaccinate our 5 to 11-year-olds who have been really hugely impacted by this pandemic. You know, there's been so many days of school lost, social activities, sports, after school programs, family gatherings. And we are really excited to have this opportunity for our kids to get things back to normal in a safe way.
Terrific. Well, let me turn for the first question to Griselda Reyes and have her ask the question. And then Marla, thank you for translating Griselda's question.
Yes. Adelante, Griselda.
Gracias por invitarme a estar aquí y hacer estas importantes preguntas. Como madre de dos hijos menores de 18 años, tengo un hijo que tiene asma. Entonces quisiera yo...
Muchas gracias. Thank you very much for having me here as the mother of 2 children under 18 years old and a child who has asthma. Adelante.
¿Qué tan efectivo son las vacunas del COVID para que proteja a mi hijo a la hora de él agarrar su primera dosis y que no le afecte los efectos secundarios por la primera dosis?
And first question is, how effective is this vaccine in protecting my child if he is susceptible to the side effects after the first dose?
Okay, great question. So let me see if Susan, if you might want to start there, and then maybe Peter on what is it that if you have some quote side effects, and we probably need to talk a few minutes about side effects, and whether or not side effects would be something that would prevent getting the second dose. Dr. Wu.
Yeah, that's a really great question. I have 3 children under 18, myself, 2 of whom also have asthma, and it is so important, even more important for children who have asthma to get this vaccine.
Hold on one sec, Dr. Wu, right there for a minute. Marla?
I'm translating to English, Griselda. Voy a también traducir a inglés. Ok.
Yes,
Gracias
please.
por tu pregunta. Yo también tengo hijos que son menores de 18 años y también me he preguntado las mismas cosas. Así es de que vamos a comenzar a darte un poco de información de cómo esto va a funcionar.
And please continue, Dr. Wu.
Yeah, so it is true. These in some people do have some side effects from the vaccine, more commonly with the second dose than the first dose,
Okay.
but they are.
Entonces sí es verdad que hay gente que padece de efectos secundarios, pero es más común con la segunda dosis que la primera dosis.
And the most common ones are soreness in the muscles and joints, headache, tiredness. A small percentage get a fever.
Y los más comunes son dolores de músculo, un poco de fatiga y cansancio, y un bajo porcentaje les da fiebre.
But none of those are reasons to not get the second dose. It's still very important to get the second dose.
Pero ni uno de esos efectos secundarios son motivo para no tomar una segunda dosis. Es muy importante continuar con la segunda dosis.
Great. And I'm going to turn to Dr. Marks. And this time you don't have to worry about interpreting this one, Marla. This will be just for the general audience. But Dr. Marks, let's go over again the comments that Susan made around vaccines and side effects and sort of what did the clinical trials. We always want to come back to the science. What did the science tell us about side effects?
Yeah, so first of all, I just want to make a point here that the side effects in kids are actually a little better than the side effects in adults because the dose is a little bit lower, and they seem to have gotten that very nicely right. It is true that after the first dose, soreness at the arm is not uncommon, and there can be some flu-like symptoms, kind of feeling fatigued, tired, maybe even a slight fever. After the booster dose, the second dose of the vaccine, there can be a higher chance of having some of that flu-like feeling. But it was only about half of kids after that second dose that had that flu-like symptoms that lasted for about a day or so. Those are the kinds of side effects that we would expect with these. We were very lucky in the 5 to 11-year-olds. That was really the extent of the kinds of side effects. A few other minor ones, but really nothing major.
Great. And so let's see, is our translator back? I would like you to be able to then summarize, if you could. I'm looking to see if our translator, Marla, is there. Good. Marla, would you then let Griselda know that the answer that we heard about side effects were key, that children have a lower incidence of side effects than even adults because the dose is smaller.
Sí. First, I'll say this in English. I've turned off my camera in hopes that it'll stop disconnecting me. He apagado mi cámara para que me deje de desconectar. Y Griselda, la respuesta que escuchamos del Dr. Mark es que los niños padecen de muchos menos efectos secundarios, dado a que la dosis para niños es una dosis de una tercia parte de la dosis normal a un adulto. Entonces, en sí, los efectos secundarios que surgen se notan menos en los niños.
Well, thank you. Yeah.
Tengo una pregunta. ¿Cómo saben que las vacunas no les va a afectar en sus vidas, en cuestión de su vida sexual, una vez que ellos llegan a su adultez, verdad? Sabemos que la vacuna solamente ha salido apenas recientemente, no más de 3 años, no más de ese tiempo. Entonces, ¿qué tan seguros están o qué tanto de porcentajes es seguro que no les va a afectar en su vida sexual de los niños o en su fertilidad?
And hopefully Marla will, there you go.
I
Were you
am
able to
so
hear the
sorry
question?
about that. Yes. How are you sure this vaccine won't affect children fertility when they get to adulthood? We know that this vaccine is very recent in studies, and none of the test people have made it to adulthood. So how could we anticipate those challenges?
Great.
Or
Dr.
signs?
Wu, were you able to hear that at all? And can you respond?
Yes, so that's an excellent question, and it had to do with what do we know or how do we know that this vaccine will be safe and will not affect the reproductive system or will not cause sterility in children. And we do know, we do have information in terms of, and I think it's one of the myths that is circulating. These COVID vaccines do not cause sterility. How do we know that? Well, we know that because there were women who were pregnant at the time and they did not know that they were pregnant at the time they received the vaccine. And yet they went ahead and actually delivered a healthy baby. We also know that there are women who conceived after being vaccinated with the COVID-19 vaccines, and it did not affect their ability to become pregnant. I think it's also important to know that this vaccine has been monitored very, very closely and carefully, probably more than any other prior vaccine. And so there is a pregnancy registry, which means that any pregnant woman or any woman who becomes pregnant and was vaccinated while they were pregnant unknowingly, they actually can get entered into a registry where they're followed throughout pregnancy.
Great.
And we want pregnant women to be vaccinated because COVID-19 infection in pregnant women causes the pregnant women to become very, very ill. So we want pregnant women to receive this vaccine.
Well, very good. Well, thank you for that. And Griselda, I think if our interpreter just very quickly could just say that what the data really does show, once again, is that that these vaccines do not affect in any adverse way the ultimate development of the child into adulthood, their DNA, their fertility, any of those issues. Would you just summarize that, please, for us, Marla?
Han dicho que excelente pregunta y a pesar de que no tenemos los datos de los participantes menores de edad, tenemos datos que hemos colectado con mujeres embarazadas y en sí no nada de los.
All right. Well, I think you got the gist of it. Thank you for joining us, Griselda, and thank you so much, Marla, for helping us out. Have a good evening. I'm going to bring in now Ian. Ian, as a member of the Asian Pacific Islander community, you are interacting with your own family and many people in your community as well. And what are the kinds of questions that you want to bring to the panel tonight?
Sure. Yeah. Thank you for having me join this conversation this evening. Just so you know, I have 3 kids. I've got a teenager who's fully vaccinated. I've got a 12-year-old who just got his first dose a couple of weeks ago when he turned 12. And then I've got an 8-year-old who is now just eligible for the vaccine. So I guess one of my questions, and this is kind of related as we come up to the travel season around Thanksgiving and Christmas, and what are your recommendations for kids who have maybe the first dose, but not the second? Like, is it okay for them to travel? Like, what are your kind of recommendations around that?
Dr. Bell, would you like to start that, and then we'll come back to Susan?
Sure, I can start it. I think we've already mentioned this on this program that getting the second dose is really important. So I certainly wouldn't recommend putting that off, like saying, oh, we'll just do it when we get back from our whirlwind trip to Hawaii. I will say that your local pediatricians love to go to Hawaii, so please invite us with you. No, I'm just kidding. I think, it's just like everything else that's going on in our lives these last 18 months. Everything is a calculated risk. So it's important for you to have the information. It's important for you to know how are you traveling, where are you going, and what is the infection rate and vaccination rate where you're going. So let's say you're getting in your car and you're driving 2 hours south to your in-laws who are all vaccinated. Probably pretty low risk to do that with somebody who's only had one vaccine. Let's say you're getting on an airplane and going to one of the states in our country who are currently experiencing really high levels of COVID. I'm not going to call anybody out because that would be really poor form. I would really seriously consider that a little bit or a lot more risk. The other reminder is that any vaccine is not truly effective until about 14 days after getting the vaccine. So I wouldn't say, first dose Monday, fly Tuesday, my risk is lower. It really doesn't work that way. So it's all calculating. I heard a parent tell me this today that they consider it their checking account. So they're thinking about how much money do they have in their checking account. I think of it as my risk calculator because everything we do now, from going grocery shopping to visiting our family, is something that we need to think about. And so there's no outright like information. You can't go to the CDC and pull up what should I do if my kid had a vaccine 10 days ago and I want to go see my mom in Hawaii. But it is important to know that they are not fully vaccinated. They have some protection, but are not fully protected.
I know I was going to come to you, Susan, but I now have a chance to turn to Bert Johansson. Bert, as you followed that conversation, we are really been talking a lot tonight about how parents make these risk-benefit calculations. If you've gotten one dose, you're certainly well protected and much better off than if you had no doses. But there's that interval period between getting the first and the second dose. How do you sort of help parents that you talk with think about making these kinds of risk calculations? We have science, but some of this also requires to make some judgments.
So, first off, where to start this? And thank you for asking that interesting question. And a lot of it goes to being able to speak to the parent at a level they understand. I had a recent experience with my own family member, and I really disliked it when the doctor spoke down to me. So you want to make sure you speak in a language, and not necessarily scientific, but give them the data. One vaccine protects you to this point. 2 vaccines will protect you to the second point. And I think you need to outline it. And I have gotten into the habit, by the way, of congratulating my parents when they get vaccinated as well as their child. Does that help answer that question?
That is extremely important, as you said, is that it's not only about the child, it's everybody in the household. If you want to have, as we heard from Dr. Nguyen and the Surgeon General earlier, that if you want to have the kind of Christmas that you want to have, you need to make sure that everybody in the house is vaccinated. Then you can take the masks off and have a normal experience. Ian, let me ask you to get your next question in, please.
Sure. So speaking kind of from personal experience with kids who are in sports, I guess my question is, my sons have been saying, well, we're vaccinated, why do we still need to wear masks? There's this, playing basketball with a mask is not the most comfortable thing to do. So how do you kind of talk to kids like you're vaccinated, but still important to wear masks? How do you message that to kids?
So let me start with Susan and then come back to Roberto.
Yeah, that's, as time goes on, it becomes more and more difficult. But as everyone has said, it's a risk calculation. And a lot of that depends on what's going on in the community. And at times where there's still substantial or high transmission, meaning there's a lot of COVID out there, your chances, even if you're 90% protected, that means there's still a chance that you could get the infection. But, I think we could reassure them. And if we all do this together, we all get vaccinated and stop this transmission, the rates get lower in the community, then it is safe for them to play sports if they're vaccinated without masks, and I think that's where we all want to be, and to let them know that there is an end in sight. We don't know when that will be, but we have a goal that we are all trying to reach.
Roberto.
Well, 2 things come to my mind. My PhD work was working on what was called an infection-permissive vaccine for influenza. And one of the things we discovered in doing the work, you have to always talk about the celebrated person in the street, was people believe you get the vaccine and it's now a shield against everything. And people don't realize that you can still get infected, albeit at a level below where you can see infection, or even a higher. And we see this with breakthrough infections. So what I've been telling my young athletes, recently down here on the border, we just had the Day of the Dead. So lots of people were asking me about collecting together, because I don't know if you guys have ever seen the ofrendas, but people collect around them. And by the way, if your photo's not on the ofrenda, you don't do well in the next life. And this is core belief. So I would tell people, I would explain what a breakthrough infection is. And again, using the Mexican culture, we don't want abuelita to get sick. On occasion, I've gotten into more complicated discussions where some data got leaked out into the local press about how vaccinated people are getting infected because unvaccinated people who have a higher titer virus are infecting them. So to the answer to your basketball playing son would be, yes, you want to protect your other players. And there are loose fitting masks, because the idea is you're going to be catching it as long as the rest of your team is wearing a mask. Does that answer your question?
Very, very good. Let me ask Peter Marks on this point, because one of the areas that so many parents and really the citizens around the country are struggling with is, what is it that we are asking these vaccines to do? And so, Dr. Marks, we heard the term breakthrough infections, and sometimes you hear in the news that people will think that means the vaccine is no good. What is it that we're asking these vaccines to do? And you better come off mute there, Peter.
Sorry about that. We're asking them to do a couple things, and I think it's been shifting what we've asked them to do. At the beginning of the pandemic, we were asking them to stop people from getting hospitalized or dying from COVID-19, and now we're asking them to do that. And hopefully, as we have more and more of the population vaccinated, we are asking them to prevent COVID-19 even from the hospitalized issues, because we now know that COVID-19, even if you don't end up in the hospital, a significant percentage of people end up with long COVID, which includes brain fog, heart problems, potentially your lung problems, and you don't want that. So we're asking it to try to prevent that. And then we're also going one further to try to hope that it will decrease transmission. There are data that are very compelling that come out of Israel that say that if you can get your vaccination rates up high enough, you can actually start to decrease this transmission. Now, whether we can get that high in this country, we just don't know, but we got to try, because that is our best hope of really trying to stamp this out and tamp it down. So things have moved a little bit, and I'll use this opportunity to say that that's where this issue of a booster potentially at 6 months to help bring up immunity and cut down on these breakthrough infections, it comes in. It may turn out that that's not really, it's not that the vaccines are failing. It's that when we developed them on the fly, we didn't have the right schedule in the first place, and that maybe, like most other vaccines in adults, you actually do need a vaccine about 6 months after your first dose of the vaccine to get you so that you have a high level of protection for a long period of time.
Great. Thank you so much. And we're going to close this panel out and move to the next one. But one question we want to ask from the chat, and I'll see which of our pediatricians want to take this. How do you convince a child to get vaccinated when they're scared of the needle?
I think we need an MA or a nurse to answer that question. We do a lot of things. I use a little Elsa magic. That's a little cold spray. I sometimes will sing a song. Sometimes some people really want to watch what you're doing. Some people really shouldn't watch what you're doing. Like they should look at a phone or an iPad. So distraction. We're fortunate enough to have nurses and MAs who are really experienced in our clinic, sometimes sitting on their parents' lap. There's lots of ways to do it. We're also exploring some needle phobia handouts that we can give parents as they're preparing their kids to come in and get their vaccine. I think the number one piece of advice that I give to parents is to be honest. We should never yell. We should never tell any lies to our kids. So if you say, oh, it's not going to hurt, or oh, it's not a big deal, that's not true. And then they don't know whether they can trust me as a healthcare provider or you as a parent. So be truthful, let them know what's going on, and then work with your provider or whoever's doing the vaccine for you to think about tips and tricks to make them more comfortable in that moment.
Terrific. Well, I'm going to thank this panel. I will ask our pediatricians and Dr. Marks to stick around again for some more questions from the chat. Ian, thank you so much for joining us, my brother. We really appreciate your being involved. Those were great questions.
Thank you all, and thanks for all the work you're doing. Thank you.
And now it's my pleasure to bring into the conversation Michelle Roberts and Lori Freeman. Michelle Roberts is the chair of the Association of Immunization Managers and the acting assistant secretary for Prevention and Community Health Division for the Washington State Department of Health and the executive leader for COVID vaccine at the Washington State Department of Health. Lori Freeman is the chief executive officer of the National Association of County and City Health Officials, an organization that serves 3,000 local health departments around the country and is the leader in providing cutting-edge, skill-building professional resources and programs that seek health equity and support effective local public health practice and systems. In short, she is the person whose association represents all of our public health officials at the city and county level. Thank them both for helping us to understand, once parents have made the decision to get vaccinated, then how are we going to make sure that they can get access to it? And let me start with you, Lori. If you can help us to understand what are states and jurisdictions doing to prepare for the rollout of the pediatric vaccine, which was just approved last night. Will access be easy or difficult? And so how do you see that?
Great to be here, first of all, Dr. Tuckson, as always. Thank you for having me. So our health departments across the country have been effectively planning for the pediatric vaccine over the past several weeks. And they're assessing who in the community is trained and eligible and plans to have the resources and capacity to administer the vaccine to younger children. I think for our audience here tonight, the best access points will include pediatricians and family docs, pharmacies, and our own local health department vaccine clinics. A majority of our health departments plan to support the whole of the pediatric vaccine effort by coordinating vaccine administration and standing up mass clinics and supporting mass clinics at schools as well. So this will look different from community to community, but all of us should be assured that there will be vaccine availability for this age group and that there will be as many access points as possible in each community, including mass clinic opportunities.
Terrific. And one of the things, Lori, that I know about you personally and NACCHO, the organization, is that you care a lot about equity and making sure that all people of color in this country have access to these kinds of life-saving interventions. What do you see as the role of community organizations, faith-based organizations in supporting not only the education about vaccines for children, but also for actually providing vaccines?
I think the extraordinary partnership with the community and faith-based organizations that has long been in place in health departments across the country, but it's really kind of taken root strongly during this pandemic, will continue to be leveraged to get as many shots as possible in children's arms. Vaccinating versus education and referral will depend on how well we do with the uptake of the children's vaccine, how quickly or not we are able to get parents comfortable with the vaccination, but ultimately, how well we are doing penetrating areas of the population that may have more questions, need more information, need to be put more at ease, have their fears eased and address their hesitancies. But I would say the good news is that we know the partnership with community-based organizations and the faith community is strong, and we know it can work wonders to reach parts of communities that are difficult to reach. And those options are available to us to extend the reach of the local health department's vaccination efforts, and we're so glad for them.
I really appreciate that answer, because if we've learned anything during the earlier stages of the vaccine effort and getting people of color vaccinated, it was the critical role of partnering with community-based organizations where people feel confident, comfortable, that are easily located where they live without having to go drive other places. And I think that I'm very encouraged that you and all of our county and city health officers are reaching out to community-based organizations, faith-based organizations for this partnership. So I thank you very much. Let me ask the same question to Michelle Roberts. Michelle, what are you seeing, given that you are the chair of the Association of Immunization Managers? This is one of the most critical organizations providing access to immunization services around the country. What are you sort of seeing in your work as you all are preparing to roll out access for kids to pediatric vaccines?
Yeah, well, good evening, and thanks for having me. We're super thrilled about the huge opportunity with vaccination for our pediatric populations age 5 to 11 just starting. We're seeing doses coming into states and local jurisdictions across the country, and vaccination starting. It's going to take a couple weeks for vaccine supply to fully stabilize, but any parent or guardian can go to vaccines.gov and find a place to get your child vaccinated.
And also the question about community and faith-based organizations as well. Is this on the radar for what you're doing? And do you think that you'll be able to provide support around the country for community and faith-based organizations to reach their stakeholders?
Absolutely. They're, really incredibly critical partners for us. So we're doing a number of things. First, we're just partnering in education and outreach together, knowing that they're trusted sources of information for their community and really will help parents get their questions answered, just like we're doing here tonight. And we're also, they're an important place for vaccine access too. So state and local public health departments and also other healthcare providers and pharmacies are available to hold kind of pop-up clinics at community centers or faith-based organizations to be able to bring vaccine to where people are in trusted places.
Terrific. And let me ask also, I know that any of our pediatricians can handle this, but are you comfortable as pediatricians that vaccines will be available in pediatricians' offices in an easy and predictable manner? Dr. Bell?
I can start. I feel bad I'm so talkative tonight, but I think that's a great question. So I am honored to be the interim senior medical director of a clinic that is in a community that was started by the Black community and serves the Black community, and we have been vaccinating since February. It was really interesting to be pediatricians vaccinating 90-year-old patients. Loved it. In fact, we are absolutely determined to vaccinate our patients and our community, even folks who are not our patients. But I have heard from a lot of my peers that it's a big lift, right? You need a lot of resources. You need a lot of logistics. You need time. You need space. We can't really stop seeing patients right now. October and November are very busy times in pediatrics, lots of other respiratory and viral things going around. Everybody has to get a COVID test every other day to go back to school or daycare. So it's been a big lift. And I think that as the vaccine becomes more available and the system becomes more streamlined, I think it will be more and more available in pediatric locations. But I can tell you one of the large pediatric groups in Seattle are not offering vaccines because it just was not effective in their day-to-day operations.
And Dr. Wu, you had a comment.
Yeah, I know that the American Academy of Pediatrics has been doing a lot, up to this point, holding a lot of informational seminars, providing technical assistance to try and get pediatric offices ready. And the supply issues are, they'll improve. But I think at the moment, even those that are ready to give vaccines, we're getting limited supplies at a time. But I would still encourage everyone to talk with your pediatrician and, be able to get your questions answered and discuss, any concerns you might have ahead of time. And so once it is available, that you're ready to go and get it wherever it is available, and, get your flu shot too while you're at it, and any other vaccines that you're due for. And if they have it all, there is no, I get this question a lot, you can get other vaccines on the same day at the same time as your COVID vaccine. You do not need to wait any time in between.
And as we close out on this part of the conversation, let me get two quick answers from Lori and Michelle. I'm wondering, and Lori, let me start with you. Are you concerned at all that access will be a problem for our public health system to, starting tomorrow morning, start to immunize our children? Will access be a problem, or are you concerned?
Tomorrow morning, I'm not willing to make a blanket statement that we're going to hit the ground running. And I will explain why in 15 seconds, which is basically that, you know, the timing of these decisions and the rigor that they go through and the layers of review and approval make it very difficult to plan things like mass clinics. You don't ever want to cancel a mass clinic if you can help it. So our local health departments wanted to plan, but do it a little conservatively. I think you'll see them hit the ground running by November 8th, but maybe not tomorrow, and maybe over the course of the next 7 to 10 days. But you will see access points, you will see availability, and I don't think we'll have a problem with that, but it just might not be tomorrow morning.
Michelle?
Yeah, I think there you'll see some vaccination is already starting, but we're just really encouraging some patience over the next couple of weeks as supply stabilizes. And as Lori said, all of our health departments and providers are getting up and running, but it is starting. And so parents over the next week may have to try a couple of different places or a couple of different ways till we're fully stabilized. But we're excited to start getting kids in, and we'll have even more capacity over the next couple of weeks.
Well, let me thank you, Laurie and Michelle, for joining us. We really appreciate it. And thank you for everything you're doing to make sure that parents will have access. And November 8th isn't too bad. So, Laurie, that's a pretty great answer. And I thank you for it. And thank you, both of you. And now, if I'll keep our docs, if you'll stay with us just for another few minutes, we want to now turn to some important issues around what's happening in the schools. We know that COVID-19 outbreaks have closed at least 270 school districts, affecting more than 2,000 schools. Some 1 million plus students and 70,000 teachers have been affected. There has been, of course, unfortunately, a disproportionate impact on children of color. I'm glad that we are joined by Kate King, Doctor of Nursing Practice, who is the president-elect for the National Association of School Nurses. And there she leads school health services also in a middle school in the largest school district in the state of Ohio. Welcome, Dr. King. And what are you mostly concerned about as a representative of the school nurses for this next stage of the pandemic as it relates to our children?
So again, thank you so much for having me. And I know all of you are excited, but I cannot imagine a group that is more excited about this vaccine for our 5 to 11-year-olds than school nurses. You know, school nurses have been the front line in schools for this COVID pandemic for a long, long time, and have worked tirelessly to make sure that as best we can, our children are safe, healthy, and ready to learn. So it's been a long road, and this vaccine opportunity just creates such excitement amongst our school nurses and our families and our parents. So with the Delta variant spiking, we really were taken, not unaware, but we were really hoping this fall that school could be quite a bit different. And in fact, school school isolations and quarantines have really increased in the fall. And that has really affected the education and the mental health of our students. And school nurses are working very hard to institute and enforce mitigation strategies in schools, such as masks and social distancing. And then, of course, quickly identifying, isolating, and quarantining positive cases in our schools. Now, the silver lining is that what we're seeing across the nation is that we are not seeing as much transmission in school amongst children in school. And I think that is a testimony to all of our school staff for, again, implementing these mitigation strategies. What we're seeing is those positive cases are coming from communities, and we're looking at different quarantine strategies because of that. We're also seeing, again, our children who haven't interacted in a school, sometimes for 6 months to 9 months. And we're seeing a lot of social aspects of children being able to learn, being able to be in group setting, and actually using the abilities that they have for their education, because it has just been so very stressful for them. So in schools, we really do want to see our children immunized. And I'm echoing what others have said. It's not just COVID-19 vaccine, but we have a great deficit in our school mandated vaccines for children because so many of them didn't get them.
I want to just on that point, and again, I'm going to bring Dr. Whitley Williams in a second, but how concerned are you as a school nurse about some of the pushback that we're seeing in the country against COVID vaccinations? Are you concerned that this may spill over into routine childhood vaccinations across the board?
I am, and I've seen that in legislation or proposed bills from state to state, that not only is there pushback for COVID-19, but the opportunity to have school mandated, the normal school mandated vaccines not be required. I've seen that happen in bills and legislation. So I am concerned about that. I really feel that we as school nurses are a trusted resource for our parents, and that we're available to talk, we're available to give education and information, but we are seeing some of that. And we had seen some of that increase before the pandemic, but I think we're seeing a little bit more of that.
I know you had another point to make, but before you do, I want to just open up one quick thing for an observation from Dr. Whitley Williams, and that is around the point you made about masks. You know, it is amazing to me still that there are such politicization and fights around whether or not someone wears a simple piece of cloth to save lives. But Dr. Whitley Williams, is there any doubt in you? I mean, you are, again, an expert in this. You are on the advisory committees for the CDC. Is there any doubt in your mind of the effectiveness of masks in stopping the transmission of this terrible virus?
There is no doubt in my mind that masks have played a very important role. Remember, we were wearing masks before there were vaccines available. And we did see a decrease at one point because of mitigation. Not only did masks allow us to have a decrease in the COVID cases temporarily, but also remember, we saw very little flu last year. Why? Because of wearing masks and the good hand washing and social distancing. I think it was, an experiment that happened naturally, but it confirmed what we knew about the transmission of flu and other respiratory viruses. So there's no question that masks play a role. And that is why, whether you're vaccinated or not, certainly in any large crowds or traveling in airplanes, and there are certain areas that we go, such as in schools, still in some of the supermarkets, you should wear a mask. That is probably one of the best protections, and wear it appropriately, covering your nose and mouth. And it's unfortunate that we're seeing a lot of bad behavior, I'll call it, based on someone being asked to wear a mask. That should not cause a confrontation, because as someone said before, we are all in this together. And if we want to stop this pandemic, there are certain things that we have to do, because it is not so much an individual right, but it is really the right to protect the public, the health of all of the public. So mask without question.
And above all, let's make sure that none of us in the community gives a hard time or attacks any of our school nurses. Kate, you had another point you wanted to make, I think.
Well, I did want to talk about school-located vaccine clinics. I would encourage parents to ask their schools if they're going to have them. One of the silver linings with COVID has been one, that people understand actually what school nurses do a little bit more than they used to. We're not about injuries and illness, although we do that. It's planning, it's public health, it's that whole health picture. And I would really like to look at, and I know we're looking at, school-located vaccine clinics. We know that research shows that you increase your vaccination rate with those because parents, students trust schools, and they trust their school nurse to know what they're doing when they're getting vaccinated at school. And it also addresses equity, because when we, in my school district, have parents who are working 2 jobs, who don't have money for gas, who can't get their 2-1 appointment even, and we encourage them to go to the pediatrician, but if they can't, we can give them at school with parent permission right there. The parent could come, but they don't have to be there. School nurses have done these mass immunization clinics for a long time. We know what we're doing. We know how to do it. We know how our school works. I know it's best in my school to do it in the gym and pull kids from different classes, where another school nurse knows that they go from classroom to classroom. It's so important, I think, that we offer this vaccine at our schools, because I think it addresses so many of the issues that parents will have.
Well, Kate, thank you so much for joining us. And on behalf of, through you, let us thank all of our school nurses. Gosh, do we appreciate what they do every day. And you are such a fine representative of them. So thank you again. We're nearing the end of our show, and I want to do 2 things. Number one, there's one question I need to address to Peter Marks that we have not addressed from the chat. And then I'm going to ask each of our physician colleagues to do a 20-30 second last round of the last thing you want to leave our audience with, as parents have been following this show and need to make the decision one way or the other about how they're going to handle the question of whether to vaccinate their kids. Dr. Marks, there has been many people who are clearly concerned about a disease called myocarditis, this inflammation of the heart. We know that it is something that occurs from being infected by the virus itself, but also there have been some reports that the vaccines may be involved in that. How do we understand this issue, Peter? And come off mute again, please.
Thank you. So myocarditis is it's probably the one effect of these mRNA vaccines that we've seen at a slightly higher rate than in the background. There obviously, you get COVID-19, there's a very high rate of myocarditis, but it does look like the vaccine, particularly in younger men under the age of 30, can be associated with a small increase in risk. What does that mean? Probably about 1 in 5,000, 1 in 10,000 cases of a mild inflammation of the heart muscle that goes away within a day generally, and doesn't seem to be associated with any long-lasting effects. The good news is that in kids less than 15, it looks like this risk decreases, and we don't know yet whether there's any risk or what the risk is in the children 5 to 11 years of age, but our modelers think that it is going to be lower than what we've seen in the older children, and some of that may have to do with males and sexual maturity, and there be less of an issue in the younger children. So we'll just have to see. As we said earlier, we always want to be honest. So that's being honest. The risk here of something very mild, though, is nothing like the risk of what could happen with COVID. So when we did the benefit risk calculation here for 5 to 11-year-olds, the benefits were, in fact, the benefits for 5 to any year-olds still are greatly in favor of getting vaccinated.
So I think, again, the context for this must always be remembered. And so many of the shows and events that I do with the community, we always have to remind people that while there is a slight concern about this, which resolves almost always on its own, the risk is not compared to zero. The risk is compared to a disease that more often by far than the vaccine creates the very same problem. So let's always keep that in context. And in that regard, I'm going to, for the 30-second round robin really fast, I'm going to start with you, Dr. Patricia Whitley Williams, because again, you are on the committee that reviews these things. And so I wonder just sort of how you respond to this issue as your closing comment.
Sure. Thank you very much for having me. Remember, these COVID vaccines are safe. They're effective. The benefit of protecting you or protecting your child against COVID-19 far outweighs any risk. I would also like to say that it's important to remember your child is in the center of the hub. It's the hub of the wheel, rather. It's in the child is in the center. It's important to immunize everybody who is eligible to be vaccinated against COVID in your household, because that also protects your child, especially for children who are younger than 5 years of age now and are not yet eligible to receive the vaccine. So vaccinate, vaccinate. Don't forget about your flu vaccination, and don't forget about all the other childhood vaccinations as well. Protect yourself, protect your child, protect your family, and that also protects your community.
Dr. Bell?
Yeah, I mean, it's hard to top that. I agree. The vaccine works and it is safe. Please vaccinate. Please get your kids vaccinated. We as pediatricians are happy to answer questions or have a conversation. I know that there is a long history of not trusting medicine, but remember, this is a global pandemic. This is not about what's happening in our country. This is about what's happening in our world. And the vaccine protects not only you, not only your family, but your whole community. It protects our elders, it protects our language, it protects our culture, and it protects our babies. So please get vaccinated.
Thank you. And now Dr. Wu.
I think ditto. Yeah, we've discussed this. It's the right decision for our family, and all my kids are getting vaccinated. And I would encourage you again to talk with your pediatrician about any concerns that you have. And this will let us be able to have a wonderful holiday like we've been hoping for the last 2 years.
And Bert Johansson. Oh, you're on mute, I think. Oh, no, I wanted to hear from Bert. All right, well, try one more time, Roberto. It looks like there's a problem there on Roberto's end. So with that, let me just thank everybody for being a part of this. This has been a really very fast pace, but I've certainly enjoyed the conversation. I want to give special thanks to our colleagues of the Association of American Indian Physicians, the National Hispanic Medical Association, the National Council of Asian Pacific Islander Physicians, and the National Medical Association. I also want to thank our community partners, both the Black Coalition Against COVID community leaders in Washington, D.C., who were so instrumental in shaping this program, along with the Sault Ste. Marie Tribe of Chippewa Indians, the Asian Pacific Islander American Health Forum, Jack and Jill of America, and Mixteco Indigena Community Organizing Project. This has been an enjoyable experience for all of us to put this together. Parents, you have tough decisions to make. We understand it. But one thing is for sure, we have an opportunity now to get our lives back, to enjoy our holidays with our extended family, and especially with our elders. You have questions. We hope that we've gotten to the answers of as many of those as we could get done in this time. Please reach out to your pediatricians. As you've heard from the American Academy of Pediatrics, our American pediatricians are standing by to be helpful. If you want to know how to get vaccinated and where to go, we've heard from the National Association of City and County Health Officers. Your public health leaders are standing by to help you understand how to get easy access to these vaccines. And so this is the moment now where we have a real chance to turn this disease around. And above all, as all of our panelists have mentioned, please remember that preventable childhood vaccines are essentially important. And whether you decide or not decide to make the decision around COVID vaccination, please get your children vaccinated from the other full range of childhood preventable diseases. This is so important. Thank you all for joining us. Thanks to all of our colleagues at blackdoctor.org who have been working so hard behind the scenes. And again, this program will be broadcast tomorrow in the morning at, I think, 9 a.m. Eastern time on the blackdoctor.org, blackdoctor.org, or it will be archived on YouTube. Thanks again, everyone. Have a good, healthy, safe